Mr. Hamada, which are the latest trends in the field of ophthalmology?
Well, actually, to be honest, there's many advances on various levels. So if we're talking about, like in this meeting, focus on refractive cornea, there has been so many advances in how to reshape the cornea, give patients a better visual outcomes. In fact, one of the very important highlights which I've listened to...
Tell us a few words of your speech, of your announcement downstairs.
My presentation?
Yeah.
Okay, so my talk today was about using phakic IOLs to improve the vision in patients with non-refractive purposes. So those patients, for example, keratoconus patient have a cornea graft in the past, children had laser vision correction in the past. So this is a new advance or horizon to use phakic IOLs such as the EVO ICL implants, which is implantable contact lens, to improve the vision in those patients. And we've shown really the good outcomes based on the publication and on experience in our center as well.
Okay. Which are your plans in your work after the end of the pandemic?
Right, okay. So, well, in London...
It's a general question.
Yeah. Well, in London, things has almost been back to normal now, because we start to see patient face-to-face. The number of patients coming for surgery is start to increase again. And I think there is, people have, the back to normal life, they want to use their vision, so they're coming more for refractive surgery, vision correction. There's so many patients were putting the surgery on hold for a while until things settle. Now they feel they have the time and the right time actually, and the freedom to do the surgery. So that's how I think it impacts on patients and on us as well as a surgeon. So you see more patients now, and we're having more kind of procedures. So surgery now back to normal as before the pandemic. Yeah. I was so pleased to come here today because there's a few things I learned as well today. One of them, for example, there is a new way to objectively measure a patient's behavior. So for example, now there are tools you mounted on the glasses, like with your device, for example, which gives you a lot of data about the patient, how they use their eyes, for example, how much use their eyes to see distance, to read, their lifestyle. So that help in giving objective as data for the surgeons when they decide about what type of refractive surgery to give to their patients. And I think that's very useful, and that's really a step in the future. So to optimize the outcomes of the surgery we do based on the objective data we get from the patients.
Okay.
But thank you very much. Yeah, thank you.